capstone really was talking about burnout in public servants. And the problem is that in our family independent staff, which is half of our department, burnout is the definition that I use is that burnout is defined as a response to extended exposure to stress. It has three identifying dimensions: exhaustion, depersonalization, and ineffectiveness. Research reports too often that human services staff, they actually experience high rate of burnout and work-related stress. And so that it was important to address the issue of burnout because there's severe implications of having burnt out staff, and they include the increase in the intention of quitting, decrease in group connectiveness, reduction in the quality of service to vulnerable children and families, and that's who we serve. So this was personal for me. It also impacts that increased job performance failures. It is linked to lower staff retention, higher staff turnover, increased absenteeism. It also, for the staff person, increases the risk of mental and behavioral disorders, diseases of the circulatory system, respiratory system, musculoskeletal system. Burnout makes folks sick. And then so the burnout contributes to making people sick. And so when we looked at our needs assessment for Erie County Department of Social Services and our Family Independence Division, 83% agreed and strongly agreed that burnout is a major issue. 67% rated their level of burnout as above average and far above average. The staff members who are employed between 1 and 10 years, they actually expressed the highest level of perception of burnout, not only for the division, but for themselves and then for their team members. So 81% agreed and strongly agreed that burnout was an issue. We use the intervention of trauma-informed supervision framework that actually was developed through UB. And we had one of the trainers, two of their trainers do the intervention. So it is an evidence-informed intervention. It provided the training, provided an overview of the trauma-informed framework for supervision. It includes 9 core competencies, talks about the impact of trauma on the brain and the behavior in the workplace. It promotes DEI, diversity, equity, inclusion, and accessibility. It supports wellness and productivity. It also talks and shares about the impact of the work, how to support self and staff, and promoting resiliency and growth. The practice setting, so Erie County Department of Social Services is a public service organization. We are the safety net system for Erie County with 1,600 staff, and people who show up at our door are in crisis at the moment they're coming into our door. And more likely than not, they've experienced trauma. And then also, which is the other important piece to this, is that our staff more than likely have also experienced trauma. And so the organization has been on a journey of becoming a trauma-informed organization for the last 8 years, where our goal was really to have every single one of our staff persons trained in a trauma-informed perspective so that they will understand the impact of trauma. So we did a lot of work around trauma-informed, helping the staff to understand that. I specifically looked at our Family Independence Division, a small unit out of the 26 different departments we have, our temporary assistance unit, and the staff that I looked at was social welfare examiners. They are not caseworkers. The requirement is not a degree to be a caseworker. You pass an exam. But for me, it was important to take a look at this specific population because there was very limited research done on first a social services district and then the public benefit side. There is some research they've taken a look at trauma and secondary trauma for caseworkers and specifically child protection and adult protection. So the staffing of temporary assistance is 126 frontline staff and 32 frontline and administrative supervisors. And so we know that it was important to use implementation science because it is a systematic way of making sure that we identify all the key issues and all the key information that helped us to develop a structured, iterative approach to program. So it's just important that to use the implementation science. I looked at the TDF to identify influences on the individual behavior and and it guided me in the identification of barriers and facilitators, also the COM-B, the model of behavioral change, and then the CFR to identify facilitators and barriers within the contextual environment. It's important that implementation provides a roadmap based on theoretical, practical, and empirical knowledge. So based on the needs assessments, and one of the implementation barriers that we found is that the supervisors would lack the time to learn and implement a trauma-informed supervision framework. The supervisors lack knowledge of trauma-informed supervision because that isn't anything we had been talking about. The supervisors lacked confidence to be able to implement a new initiative, as they said. And supervisors and staff are resistant to new initiatives. Anytime we talk about doing something new, we have a lot of work to do around knocking down the resistance. So those were the implementation barriers. And so we developed the implementation strategies that including reducing, revising job responsibilities, because too often we ask folks to do more without giving them the capacity to do so. We provided 4 3-hour monthly trauma-informed supervision training sessions for the supervisors. And then we also provided 1.5 hour of monthly coaching sessions so that they could practice what they learned in the training sessions. And then we also utilized champions to help facilitate the uptake of the intervention. There were about 7 research questions, and I won't go through each of them, but it really asked about the reach, how many people how many supervisors participated, implementation, how many job responsibilities, what was the fidelity to the protocol that I laid out. And then the last question really was about the effectiveness of the trauma-informed intervention on decreasing burnout. The measures that I used included attendance sheets, so that was a 1-point measure just to know how many of the supervisors actually attended. The tally sheet for job responsibilities, because again, that really was a big point of really reducing or revising job responsibility as one of the strategies. We used the secondary traumatic stress core competency in trauma-informed supervision self-rating tool. Then I developed, I call them trauma-informed supervision pre and post surveys for both staff and supervisors. And then we use the Matchlock Burnout Inventory for Human Services, the MBI. Our key findings is that we did see, well, there was only one of the results that was statistically significant. We saw an increase in all of the areas, but not to the level of significance in terms of the statistics, except for a decrease in personalization in the component of burnout. So for staff, we did see an increase in trauma-informed supervision knowledge. We saw an increase in interest, but interestingly enough, it was not attributed to the champions. They were very clear, yes, we are more interested, but not because of the champions. The champions were considered helpful with increasing readiness, though. And then the only statistically significant change was decrease in personalization in the component of burnout for the staff. And so for the supervisors, 83% of them completed the training and coaching sessions, but we saw 0 reduction and revision of job responsibilities. We actually had a major change during the research, where we had compliance issues, we had increased applications, we had changes in our system. And so we did not have the opportunity to reduce or revise job responsibilities at all related to this. We actually increased job responsibilities, and a lot of revision took place. So that was the contextual environment of what was happening. Our training sessions were considered helpful with increasing knowledge. The coaching sessions were also helpful with knowledge and confidence increasing. and the use of champions was inconclusive for interest and readiness. So 50% said they weren't helpful, and about 50% said they were helpful. But I do believe it had a lot to do with the changes in the environment, because the champions were actually some of the supervisors who were making the changes. So key insights and takeaways. This is the one area that I didn't get any. Remember, I said we had 0% decrease or revision of job responsibilities. And we know from research that reducing job demand actually has the largest impact on burnout. And also, I think that the previous exposure to trauma-informed training may have lessened the impact of the training, because they were already at a higher level of knowing the principles of trauma-informed. So the impact of another training, I think, was lessened because of that. It will inform our next iteration of implementation, and additional research is needed. And in Jones, and I think this supports what Jones talked about in his 2020 research, that trauma-informed supervision may be an innovative approach to addressing burnout. And then for next steps for us is that when we're looking at the next iteration of trauma-informed supervision, because we are looking to move it throughout the entire department, is really to strengthen the roles of the champions, continue to identify opportunities for reduction and revision of job responsibilities, and utilize trauma-informed evaluation developed by the Institute on Trauma and Trauma-Informed Care, because we use that STS, and it had 65 different questions. And, in the middle of lots of work, people are not responding to such I think, a lengthy evaluation. So our goal is that we will be working with IDIC and to use their trauma-informed supervision evaluation. And again, implement trauma-informed supervision in all units within family independence first. And then our long-term goal is that all of Erie County Department of Social Services supervisors are trained in trauma-informed supervision.